It's our pleasure here at ATS 2014 to have with us Dr. Zeenat Safdar from the Baylor College of Medicine. Thank you for joining us.
My pleasure.
So you presented a poster on pulmonary artery diastolic gradient. What can you tell us about that?
It's an interesting study that we undertook from the right heart cath database at Baylor College of Medicine Pulmonary Hypertension Center. We were trying to find out who are these patients who are diagnosed with group 1 pulmonary hypertension, which is the most patients that are referred to us. But there is a population of patients with group 2 pulmonary hypertension that are referred to our Baylor Center, and we want to correctly identify them so that they get the proper treatment that they need to get them out of their heart failure. So we looked at our gradients across the pulmonary vasculature. So we looked at the right heart cath database and we looked at the gradients. So specifically we looked at the transpulmonary gradient and the pulmonary diastolic gradient. And we were able to identify 3 subpopulations of group 2 patients. Patients that had normal hemodynamics and normal pulmonary gradients, and there were patients who had just elevated transpulmonary gradient and had normal DPG or the PA diastolic gradient. But there was a subpopulation of patients who had elevations of both gradients. And those patients although had similar hemodynamics than the other two, but they were very similar to the group 1 pulmonary hypertension patients. And these patients, we believe, have a mixture of pre-capillary and post-capillary pulmonary hypertension. And maybe, this is just a hypothesis generating study, that maybe they are more akin to the group 1 pulmonary hypertension patient. And maybe down the road we would be able to better identify these patients and maybe treat them in a fashion that is similar to group 1 pulmonary hypertension patients.
How is measurement of DPG useful in identifying group 2 patients?
I think it is uniquely positioned to identify these patients because we didn't find any patients who had an elevated DPG that didn't have hemodynamics which were not similar to group 1 pulmonary hypertension. We think DPG can identify those patients who have a mixed or combined pre-capillary and post-capillary pathology in their pulmonary vasculature. And these patients also have hemodynamics which is similar to group 1 pulmonary hypertension patient, and their walk distance is also lower, similar to group 1 pulmonary hypertension patients. So we believe that the disease have progressed to such an extent that although their disease may have started in the left heart, but now the vascular remodeling has progressed on to such a degree that now they have pre-capillary remodeling also, giving a picture that is very similar to your pure pre-capillary pulmonary hypertension or group 1 pulmonary hypertension.
What do you think are the clinical implications of your findings?
I think it's important for clinicians when they are doing the right heart catheterization to calculate not just the TPG but also calculate the PA diastolic gradient, because as we have shown in this study, and also a recent study also showed similar results to our study, that DPG is a measurement that has not been used clinically as often as it should. And DPG is able to identify those patients who have vascular remodeling which is severe and not just passive congestion leading to left heart failure and then right heart failure.
Doctor, thanks for stopping by and sharing your data with us, and best of luck to you.
Thank you. My pleasure.